Podcast 6, Week 8. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing, and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at Week 8. Do you get headaches? During pregnancy, you may have more of them. They can be caused by many things. Acetaminophen can help relieve pain, but use it sparingly and only for a short time. If you don't want to take medicine, try other things. Exercise, get enough sleep, drink lots of water. Nearly 20% of all pregnant women have more severe headaches, like a migraine. Some women take triptan medications to treat them. Talk to your doctor about using these meds now. And if you use Botox to treat migraines, ask your doctor about continuing it during pregnancy. COVID-19 is still around and may be for some time. If you haven't been vaccinated, talk to your doctor about getting the COVID vaccine. Most experts believe getting the vaccine before or during pregnancy is safe. Many women experience an occasional excruciating pain in their buttocks and down their legs. It's called sciatic-nerve pain or sciatica. Some people mistakenly refer to it as sacroiliac pain, but it's not the same thing. Sacroiliac pain feels like a sharp jolt of pain on either side of your back or hips and may extend down your legs. Your skin can go through a lot of changes during pregnancy. You might get acne. It can range from whiteheads and blackheads to inflamed red bumps. Flare-ups in the first trimester may be caused by changing hormones. Ask your doctor about using over-the-counter treatments before you use anything. He or she can recommend safe products. Nearly every pregnant woman thinks about miscarriage. Miscarriage occurs when a pregnancy ends within the first 20 weeks of pregnancy. After 20 weeks, loss of pregnancy is called a stillbirth. People want to know what causes miscarriage. We really don't know. We think the most common reason in early pregnancy is abnormal development of the embryo. Signs and symptoms of miscarriage can include bleeding, pain, rupture of membranes, dilatation of the cervix, and passing blood clots or tissue. If you think you're having a miscarriage, call your doctor immediately. An ultrasound may help if you're more than 7 weeks pregnant. Stillbirth is the death of a fetus after 20 weeks of pregnancy. We don't know all the reasons stillbirths occur, but about half may be related to problems in the fetus. Having a stillborn baby can be devastating, and it can take time to recover. Your doctor may have suggestions to help you through this traumatic time. Take heart. If you suffer a miscarriage or stillbirth, research shows you have a 90% chance of having a healthy pregnancy the next time you get pregnant. And you did get pregnant, which is positive in itself. It's hard to eat nutritiously for every meal. But if you include a whole grain product, fruits and or veggies, a lean protein, and a healthy fat in each meal, you'll be on the right track. Be aware, your prenatal vitamin is not a substitute for food. Food is your best source of nutrients. Do you use marijuana when you're not pregnant? Do you think it's okay to use it during pregnancy? It's not. Marijuana today is extremely powerful. Using marijuana in any form during pregnancy, whether it's eaten, applied as oil, smoked, or vaped, has been tied to an increased risk of stillbirth. The more you use, the higher the risk. Exposure to secondhand marijuana smoke from other people can also increase your risks. We're often asked if it's okay to use medical marijuana during pregnancy if it's prescribed by a doctor. There's no difference between medical marijuana and regular marijuana. Both have the same harmful effects on baby. Please don't use any products containing marijuana. Like alcohol, no amount of cannabis has been shown to be safe during pregnancy. The impact on your baby may last your child's entire lifetime. You may have to have a lot of tests at your first prenatal visit. Most are screening tests that give you odds of a problem occurring. If a screening test shows there might be a problem, a diagnostic test is usually ordered to determine if a problem actually is present. Most screening tests are done on your blood. Don't worry, only a vial or two is usually needed to perform all the tests. If tests are ordered, ask your doctor what he or she will be checking for, and be sure to follow up on test results. Have you heard you shouldn't empty a cat's litter box when you're pregnant? It's true. If you have a cat, you need to be concerned about toxoplasmosis. It's a disease that can lead to miscarriage or stillbirth, and it can damage baby. It's spread by contact with infected cat feces. So be cautious. Wash your hands after petting your cat. Get someone else to change the kitty litter. Keep cats off counters and tables. These simple acts can help keep you safe during pregnancy by preventing the spread of bacteria and viruses that cause the infection. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.